Good morning. My name is Deanne Jackson, and I am the Compliance Officer for Ashford Medical Center. Today I'm going to be giving you a briefing on the moral right to health care and how it affects our facility. My discussion topics are the moral right to health care and why it's important to our organization, the Code of Ethics. I will touch a little bit on the Stark Law and medical malpractice. First, let's start off with the moral right to health care. According to Bustillos, there are 4 foundations our healthcare organization must have. This includes code of conduct, value statements, vision statements, and mission statements. All of these are important because it basically talks about how healthcare organization personnel act with one another. It sets our goals, our principles, and our commitments. We provide inspirational statements for our staff members so we know where our organization is headed. And then, last but not least, we operationalize the goals set forth by you leadership in our organization's visions and value statements. Why is this important? Because this sets the foundation for our facility and it outlines everything we do to be effective for the mission and our patients. And taking care of our patients are our priority. Why they have a moral right to health care is because healthcare institutions can be said to have a conscience. This is a convenient shorthand for the sum total of our mission and commitments. Individuals within our organization, including everyone practicing here and working here, should have a say-so in the formation of the institution's mission and values and should commit to them. And this is a quote by Tomasa. And it is important because we need everybody involved in our mission and vision. They know where our organization is headed and they know how to execute the mission to provide great care for our patients. The Code of Ethics. Power in healthcare. We should empower the patient and providers to have equal amount of say-so in doctor and patient relationships. Have the patient be a part of their treatment and their care. Do not make all the decisions for them. This, to me, again, is their moral right to health care. We must have an informed consent, respect and value in one's health care. Inform them of their treatment options and have them consent to receiving them. Patient Bill of Rights. This lists what the patient is entitled to when being treated in our healthcare organization. They have a right to, fair treatment, be treated with dignity and respect, and so forth. And last but not least, privacy and confidentiality. Everybody that comes in our facility has a right to privacy and confidential care. And this was also a statement by the American Medical Association. All of these code of ethics are important because if our patients don't trust our facility and our providers and healthcare workers that work here, then they will lose faith in the moral right to health care. The Stark Law. A quote from J.P. Wood, "The Stark Law prohibits a physician from making a referral for certain designated health services for which payment can be made under the Medicare or Medicaid programs." Now this is important to know because our facility does not want to be sued or fined because we are trying to circumvent the system. We need to play by all the rules, policies, and regulations, and therefore this enhances our facility and patients will actually trust our organization and the care we provide. Which leads us into medical malpractice. First of all, the federal government mandates patient safety and quality care. We must be Joint Commission accredited. Our providers must maintain the utmost licensure, registration, and credentialing that they are trained to do. Professional standards, guidelines, and policies must all be in place and followed, as we must meet compliance to ensure that we are providing the best care possible. Our overall goal: treat our patients and reduce the risk of liabilities. And don't forget the tort laws. In conclusion, I have given you a briefing on healthcare organizations, their moral rights to healthcare for patients, our code of ethics, the Stark Law, medical malpractice, and these topics are critical to the success of Ashford Medical Center and healthcare organizations around the world. And the most important part, it is critical to the patients we treat.